Functional neurological disorders are very varied. The most common are functional seizures. The second most common are functional movement disorders, of which there are very many types. The most common of those are functional tremors and functional myoclonus, functional dystonia. There's also functional sensory loss, functional difficulties with speech. Almost any neurological problem can be functional as well as caused by another type of pathology. So the question is, in patients, why do some patients have functional seizures and other patients have functional movements? And we don't fully understand the reason for that. But one of the things that seems pretty clear is that patients tend to mimic things that they know or have experienced. So for example, someone who has a parent that has had a stroke with paralysis, if they have a functional disorder, they could well have a functional weakness or functional paralysis themselves. Someone who has a relative with a seizure disorder could well have functional seizures. So I think that mimicry is one of the aspects that explains why people would have one disorder rather than another. However, this is one area that certainly needs more work. So as far as we can tell, in relation to the pathways, there is an underlying propensity or an underlying disorder which is probably similar. But then there has to be something different that will produce the different manifestations. So I think that, again, going back to Charcot's sense of a dynamic lesion, he felt that the place in the brain that would be responsible for something like weakness would be the same as it would be if someone had a stroke causing weakness. So the place is the same of that final outcome, but the underlying disorder which leads to the difficulty may well be in common. And the evidence for that, which I discussed a lot in my talk, is probably an underlying hyperactivity of the limbic system in the brain.